Good morning. This is All India Radio, Kohima. The morning news read by Jonas Yantan. The total COVID-19 cases in the country has gone up to 9,353, with active cases standing at 8,049 till last night. The active cases include 35 from the northeastern states, with Assam having 30 positive cases and one each from Arunachal Pradesh, Manipur, Meghalaya, Mizoram and Nagaland. According to the Ministry of Health and Family Welfare, of the total cases, 980 have been discharged from hospitals after being cured. It also includes the first case of Manipur, while one has migrated. In the aftermath of a Dimapur-based 33-year-old patient confirming positive for COVID-19 in Guwahati on Sunday, a total of 36 suspected sample cases have been sent for testing from Dimapur and Kohima district of Nagaland. According to Principal Secretary for Home, Abhijit Sinha, the suspected samples includes 22 from Kohima and 14 from Dimapur districts who might have come in contact with a patient who has been detected positive for the virus. Sinha said the patient had returned to Dimapur by Air India flight 709 from Kolkata on 24th of last month, and contact tracing of the co-passengers who travelled with him on the same flight has been completed. He said all the members of the joint family of the patient have been already shifted to the government quarantine centres. Following the first confirmed positive case of COVID-19 from Marwaripati in Dimapur, the entire area including Korapati has been sealed. The wholesale and retail market located at GS Road, Dimapur, and retail shops at Marwaripati and Korapati has been closed. However, the essential commodity shops in other localities were open during the relaxation hour. PRO of Dimapur Police informed that Marwaripati and Korapati area has been closed, while security personnel are deployed at strategic locations within the area. He, however, said that only those with a written permission from the competent authority are allowed to pass through the area. He said Zion Hospital, Dimapur, has been sealed. Sources said that the medical staff of the hospital who came in contact with the patient are being quarantined at the hospital. Meghalaya reported a first COVID-19 case despite enforcing all precautionary measures by authorities. Health and Family Welfare Minister A.L. Hek confirmed that a doctor based at Bethany Hospital, Shillong, tested positive of the COVID-19 yesterday. Chief Minister Conrad K. Sangma informed that the state government is fully prepared to tackle the situation and urged citizens not to panic. He said that any citizen who has visited Bethany Hospital after March 22nd are to report to the state helpline number 108 to ensure that contact tracing can be done. Following the first positive case, the district magistrate has imposed curfew of 48 hours in Shillong agglomeration from 6 a.m. today, with the exception of essential services. In the light of government's decision to resume passenger trains and commercial flights in Nagaland, the Naga Council Dimapur NCD said that restoration of services poses a serious threat of spreading the dreaded disease in Nagaland. In a statement, NCD pointed out that there is no concrete system in place to take stock of those coming by train, but restriction of all modes of movement has helped in containing the outbreak of COVID-19 in the state. It therefore requested Nagaland Chief Minister to personally intervene to restrict movement of all modes of passenger trains, flights and motors passing through Dimapur. Maintaining that the absence of testing laboratory for COVID-19 in the state is one of the biggest challenges, NCD said Dimapur is the entry point and commercial town of Nagaland. In this, it sought the Chief Minister's intervention in setting up COVID-19 testing laboratory in Dimapur at the earliest. It also requested him to adequately address the need for sustainable and equitable supply of PPE for the frontline workers and media persons. Following the resumption of offices, both in the Secretariat, Directorate and various departments under state government with skeletal staff, the Health and Family Welfare Department, in addition to the standard operating procedure on disinfection, has requested all concerned to strictly follow the set of advisory. The SOP has been issued to maintain safe environment at the workplace, some of which include no hospital-based personnel are to enter the office premises. All working places and work stations, particularly frequently touched surfaces, should be sanitized with 1% sodium hydrochloride solutions at least 2-3 times and whenever required. It has also asked the officials and staff not to shake hands and also to practice hand hygiene by frequently washing with soap and water, while hand sanitizers should be applied where hand washing facilities are not available. The staff have also been asked to practice respiratory hygiene by using handkerchief while coughing and sneezing and to avoid random spitting. They have also been asked to avoid crowded places and social gatherings. Prime Minister Narendra Modi will address the nation at 10 a.m. today, the last day of the 21-day lockdown nationwide against COVID-19. He is likely to announce the decision with regard to extension of the lockdown. With that, we end the morning news. Have a nice day.